Okay, so now we are on to Module 3, and this is how your voice works. And this will give you some insight into possibly why something's not working. You might help you know why or how to go about fixing it. We'll also give you some introductory information about physiology of the body and physiology of the larynx. And that is one syllable, not two. It's not larynx, it's larynx. There's no extra Y in there. So that you can talk about it in a way that shows you know something about how your instrument should work. So I have here just a regular basic balloon, yeah? And, I don't know, it's one of those party balloons, 100 count. We'll see if I can get some air into it. Well, I'm trying. Let's see if I can get some air into it now. Okay, so let's think about this as being my lungs. Air happened to go in there because I increased the air pressure going in. Prior to that, there is no air pressure in here. But when I increase the air by blowing air in, air happens, and now I've got some pressure in my lungs, yeah? All right, so let's say this part is my neck, and where my pharynx is, where my vocal folds ride, and that this is my glottis. When I talk about subglottal, I'm talking about below. I'm talking about down here. If I talk about supraglottal, that means above. And let's say that the little ridge at the top are my vocal folds. So anything up here is supraglottal. Anything below that ridge is subglottal. Now, in order to decrease the pressure here, I have to release my folds, right? And when I do that, the air comes out. And this is how breathing occurs, basically. So my lungs are, let's say, just an empty balloon, and when air goes into my lungs, it's really basically about a vacuum, and the muscles around it cause a vacuum, and air rushes in. And then as those muscles contract in the opposite direction, then it causes air to leave the lungs. And my folds, when they're apart, I'm in respiration. So my folds are apart. But when I talk, or if I go, I'm phonating. That's phonation. That's just making sound with my vocal folds. They come together and they vibrate in a way. And that air is the source of that vibration. So, if I want that vibration to be steady, right? Then I need my folds to stay together in such a way that they vibrate at a rate that's consistent and steady, and my air is steady. But if I am squeezing, then air goes flying out of my body and I can't contain it. That is the secret to really great singing, is having control over the air leaving and coming from the body. So, how does the voice work? Kind of like what I showed you. This phonation, thing that we need to create sound, we need three things. We need the energy source or the power source, something that actuates that sound, that phonation. We need something to vibrate, and we need something that enhances the sound. If I talk about the piano, and I'm pointing over there, but I don't know if you can see it or not, but there's a piano right over here. And if I talk about that piano, when I play that piano, the hammer that comes up and hits the string, that hammer is this power, the source. And then the string vibrates, and that's my vibration of sound. That's what sends the air molecules somewhere. And then this piece of furniture, this wood, is what then becomes a resonator. and it resonates and amplifies the sound. Well, your body needs to amplify the sound, or we would hear it as if it were a whisper. So, when talking about any instrument, you can talk about something like the piano, or you can talk about a violin. Why does the piano sound the way it does and the violin sounds the way it does? Why is the violin higher? Part of the reason why it's higher is because it's a smaller instrument. And the human instrument is not that much different. Often when somebody very large walks in the room and they're a singer, I know pretty much that voice is going to be pretty big. If somebody petite walks in the room and they're a singer, I know their voice is probably not going to be as loud as, say, somebody who's 6'4". So the human instrument is very similar to actual instruments that you see in the orchestra or something like a piano or a guitar. So what is the thing in our body that drives the force, that is the power source to our singing, our music making? It is air. Without air, we cannot phonate. Just try to hum and shut your mouth. Can't do it. Air cannot go. Air will not go because you've literally stopped airflow. And when that happens, the folds cannot vibrate and they don't come together. So we think about that actuator as being our air, and as we exhale, that brings power to the voice. Then the vibration occurs in the vocal folds themselves. Now in a few minutes you're going to watch some videos that are of vocal folds. When you first look at those, do not be afraid. They are actually not of the female anatomy. They are actually vocal folds. And I've said it, I've put it out there. We will all laugh when we see them because it looks very much like a gynecological exam. And it is not that. It is vocal folds. So don't be afraid that you've just linked into some porn site. It's not a porn site. It is actual vocal folds vibrating. And it does look really weird. And if you're squeamish in any way, you might want to be careful about some of what I've sent you when it looks at polyps and voice cancer and some things like that. It can be pretty gross. But it is important to know in vocal health, especially, like if you're having some sudden hoarseness or things like that, it's important to know what you might be dealing with. So it's great to look at those videos and educate yourself. Those folds, much like this balloon, they come together and they vibrate. So when you sing an A, and I'll play that pitch for you, when you sing an A, right there, your vocal folds are vibrating at 440 cycles per second. That's fast, very, very fast, right? Ah! The vocal folds have vibrated 440 times in that one little second of time. That is what makes that pitch. The higher I go, the many more times that it vibrates. So that power source, air, drives through the vocal folds. The vocal folds then begin to vibrate. And based on what pitch I hear or I'm telling my voice to do through a neurological response, right? When I sing with the radio, I'm not thinking about pitch. I'm remembering how it goes. And my brain sends a neurological response and says, you will vibrate 440 times per second. Now 880 times per second. Now 662 times per second. It's crazy when you think about it, when you think about how quickly those firings happen from the brain to the folds to approximate pitch, and how quickly they vibrate for that, and how quickly they can change, say from an octave lead. Being a much lower time per second to that 440 time per second. All in a split second. I'm not telling my voice to do that. It's a neurological firing and a response. And when you think about that and you think about some of the songs that you hear, it's amazing, right? The human instrument is amazing. So when those folds come together and they vibrate in that way, then you get this buzz. And we know it's kind of a buzz because we've had a lot of physicists excise the larynx and blow air in it. And when I say excise, I mean do surgery on a cadaver, take the vocal folds out, the larynx out, and try to mimic having sound come from those vocal folds. But without them being in the body and in the pharynx area, and without the teeth and the hard palate and the skull and the chest cavity and the body, the resonator, the thing that makes it resonant, it's just noise. It's not until it gets put into a resonator that it amplifies that and makes it hearable to the listener. So you should find some links that will do some additional explaining of that. So when I talk about the vocal tract, I'm talking about what happens right above this bone right here up to what we call the soft palate. So if you want to try to find the soft palate, you can take your tongue and go right across the hard palate. Or feel it, and it's in the very back, and it's where there's a ridge, there's hardness, and then there's a ridge, and then there's softness. Right almost in front of where that little thing hangs down. And you want to think about that soft palate. All of that is part of the vocal tract. And without that, we don't have this pitch or sound that gets amplified and sent into the room, and we perceive it as a melody or even in speech. So when I whisper, my vocal folds are not vibrating, but you are hearing what you hear because of my vocal tract. So I can say, I'm changing my vocal tract, which changes the sound of that, changes the vowel sound. You recognize that, hopefully, as E-A-O, E-A-O, E-A-O. And that is because I'm changing the shape of my vocal tract. Really important. I can make my sound warm or bright depending on what I do with that vocal tract. So if I want a brighter sound, I just think about ee. And if I change my vocal tract to make it warmer, this is what that might look like. So you can see that I've not changed pitch at all. It's the same pitch, but I have changed the shape of my vocal tract to give it a brightness at first or a warmth there towards the end, and then I went back to that brightness. So that is how I'm resonating. If you can practice that by spreading your lip, finding a pitch, and just going, and you can hear it go from bright to a warmer pitch. I can also change it by changing the length of my vocal tract. So if I yawn and I send my larynx, which you're going to feel right here, you can feel the larynx right here, and I yawn and I can feel my larynx go down. Oh, I have a terrible cold. I should have somebody else demonstrate this. Oh, I've just changed the shape of it by allowing my larynx to come up. Then it sounds a little different, and you can hear that. The shape of the vocal tract is different for all of us, and that's why you know the difference between, say, your favorite pop singer and your favorite country singer, and why you can pick them out. Why you might hear, say, Adele and Beyonce sing, and you know very easily whose voice is whose, because they have different vocal tract shapes, and everybody's a little bit different. So that's what makes the human voice so unique, as opposed to, say, violins, or say, an oboe or a piano. If you're a listener and you're not a player of an instrument, and you hear two oboes together, you might not pick up on this subtlety that, oh, that's so-and-so's oboe and that's someone else's oboe. But two people sing, and you can tell the difference between their voices. And that's because the human instrument is unique every time, just like a snowflake or something like that. We all have very, very different instruments because we are built and shaped differently, have different DNA, have different life experiences. That plays into it as well. So, to recap, our vocal tract is made up of the nose, the pharynx, that's that space that I talked about, our mouth, and all of that amplifies and modifies the sound, and it makes our voice distinctive. And your vocal resonators are the chest, the trachea. Now the trachea is where air comes in. Air comes in through the trachea, passes through the cords and into the bronchi and into the lungs, and separates and goes into the two lungs. So that trachea also is part of my vocal resonator. The larynx itself, the mechanism that holds the vocal folds, which you'll find more on later. The pharynx, that's all part of that soft tissue in the back of the mouth, where your soft palate is that I talked about. Even the base of the tongue is all part of the pharynx. The oral cavity, your teeth, the hard palate, your gums, the gum line are all part of that oral cavity. The nasal cavity,
This, and you can tell that I have stopped up my nasal cavity by doing this.
and it's changing my sound, right? Because I've changed my resonator just by simply doing that. And then the sinuses. The sinuses are also, these hollow cavities that sit in the head and around the nose, and they also have a way of vibrating and enhancing the sound. So we have a three-step process. We have the power, the air that is moved through the vocal folds. The vocal folds then come together and vibrate, and then amplification happens as it moves through that vocal tract and through past the resonators. So now that you kind of have an idea about how the voice works and what we're going to talk about when we talk about the larynx or the pharynx or the vocal tract, you should be able to name some of those, and there are some links and also some papers that you can download that will tell you what part of that is important and what terms you should know there. So, if breath is the power for phonation, then how do I breathe for singing, right? This is what the big question everybody wants to know. And there are different kinds of breaths. One of them can be a high, what we call clavicular breath. So that's a high breath that you breathe here. And you do that when you are afraid, or maybe you're about to sneeze, or there are reasons why we do them. Then there is this very low, deep breath that happens only in the belly. And you see sometimes babies breathe in that way. And then there's a breath that we call the thorax breath, or the thoracic extension of breath, where you want the whole body to react to that breath that comes in, all the muscles to engage, and for your whole body to be engaged in that breath process. So when people say, well, I sing from my diaphragm, no, they don't. It is not something you sing from. The diaphragm is a muscle that is involved in breath, but you sing from your voice, the larynx, and the power of that is driven through the lungs and through lung capacity. So we're going to talk about how you get better lung capacity. So when my lungs, the air pressure in my lungs have decreased, it creates a vacuum. Air rushes in, and then as my body squeezes on that vacuum, air goes out. Now I don't have to think about it. It's totally neurological. I don't have to think about it at all. I don't have to go, breathe. Now let go of the breath. It just happens. It's just something, the minute you're born, you begin to do it. The body knows to do it. The instrument knows to do it. It's then through life and through life experience and over time that we become inefficient breathers for a lot of different reasons. Sometimes it's because we just forget to breathe when we talk, and we get used to being in that state. So for singing, though, we need a very definite technique about it. We need to have definite technique about how to breathe and how breathing helps us, since it is the power to our voices and to our instrument. So watch those couple of YouTube things that I have, and you'll find out some other things. Now, I'm gonna ask my colleagues to come up, and we're gonna go through some exercises and discuss some of the stuff that I've given you, some of the information I've given you, and then we'll lead through some demonstration. So Be sure you look at those links though first. Thanks.